Hello and welcome. My name is Amanda Popila and I'm a researcher in the Human Capital Practice for the Conference Board. I will be your moderator and host on today's webcast, Wearable Technology's Potential to Help Detect Illness. And here are some of the questions that we'll answer for you on today's webcast. We're going to talk about how FitBit is contributing to medical research. We'll talk about the promising results of a new study to help drive solutions for employers. And we'll share the potential of new COVID-19 research that FitBit is conducting and how it has potential for identifying future outbreaks. So I know that a lot of companies on the call today are thinking about when to reopen offices and how they will reopen. So we're going to talk a lot about some information that will help you with those decisions today. But before we get started on that topic, I just want to remind you all that CEU credits are available if you're watching this webcast live today. So please make sure that you type in your name, email address, and the type of credit you need into that box below. And if you're looking for CPE credits, do remember there are those 3 pop-up boxes that will come up throughout the webcast. And with that, I'll introduce our speaker for today. Dr. John Moore is a physician, engineer, and the medical director at FitBit. He's the former CEO of Twine Health, a Cambridge-based company recently acquired by FitBit. John studied biomedical engineering and then medicine at Boston University, and then left the clinical career path to earn a PhD at MIT. His research includes the intersection of health psychology, learning science, and human-computer interaction. So John, it's great to have you with us today, and why don't you get us started?
Thanks very much, Amanda, for having me, and thanks everyone for joining us today. It's a pleasure to be here, and I look forward to questions and interaction with you later on in the presentation. So when the pandemic started, FitBit's first response to this was to start looking at our data and trying to understand what was going on with the population of Fitbit users, and also asking them what was causing challenges for them, how could we help, etc. And one of the things that we learned pretty quickly was clearly that people were less mobile. They were sheltering in place, they weren't getting out and walking as much. Obviously, tracking steps is a big thing that Fitbit does, just one piece of it, but something that we're known for. And we looked around the world in different cities and different demographics and saw a pretty quick drop-off in the mobility of individuals, which in some ways is a challenge, right, because people are getting less activity, but in some ways was a blessing, right, because the instructions from municipalities, from the government, was to shelter in place, and people were doing it. What we found that was quite exciting was that in our user base, despite being less mobile, despite getting fewer steps, people were actually getting more of what we call active minutes, meaning that their heart rate was getting up, they were getting exercise, and they were adapting. In addition, they were getting more sleep than they were prior to the pandemic. If you're aware, a lot of what Fitbit does is not just tracking steps, but helping people with activity, nutrition, sleep, and mindfulness. So seeing that people were getting more sleep was a valuable thing to learn. So we started to ask people, well, what are the challenges? What can we do to help? And our users were clear that they were struggling with adapting with all of those behaviors because of being at home, because of their children not being in school, because of not taking their usual commute to the workplace, and they needed ways to adapt. So one of the first things that we tried to do is help people to find new ways to become active. So we released a lot of videos that were about workouts at home or workouts with the family. And not only were they things that you could do on your own, but things that you could do with people remotely and live. So live workouts were something that we started to do. And the goal here was to figure out how can we not only help people adopt healthy behaviors in a challenging time, but how we could help them be socially connected, because that's a powerful piece of this. Also, providing them a lot of pieces about mindfulness, about meditation so they can improve their sleep, about mindfulness exercises to be more mindful about what they're eating, because now that they're at home and not in their typical routine. Things are changing.
Yeah, and that kind of brings up for me, so we're talking a lot here at the conference board about the heightened stress and anxiety that people are facing, and when we're looking at organizations and how it's present in the workplace as well. So we're seeing that more people are, I mean, we all know what's going on right now. There is just more stress in our lives. So are you seeing that with Fitbit users? And if so, kind of what are you focused on there?
Yeah, absolutely. It's something that we started to hear from our users right away, that they needed ways to adapt to this. If someone's too stressed out or has other things that are weighing on them, they're not going to be focused on making healthy choices about their activity or their nutrition or their sleep, right? It's fundamental that we need to help people to manage that, and that's another area where we leaned in. So not just having the mindfulness exercises that I talked about, but also providing human health coaching, also providing webinars and podcasts that were about mental well-being and mindfulness and stress management. So really providing a well-rounded set of resources there to help people with that challenge. Also, the social connectedness piece of it is a big part of that. They're all interwoven, right? That you need to address the stress management piece head on, but one of the best ways that you can manage stress is to get active, right? Now we couldn't get out in the sun and out in public as much as we could before, but there's still ways to get active and battle that. And the other way to battle it is to be connected to others socially. So from there, that was just a bit about how Fitbit, what we were seeing in people's activity while they're sheltering in place, things that we could do there. And a lot of those principles are generalizable, right? They're not specific to Fitbit, but how can you give people ways to adapt their activity, their nutrition, their sleep, and their mindfulness in this challenging time? Give them resources that allow them to lower the friction to finding new ways to change their routines. From there, organizations started thinking about, well, not only do we need to help people while they're working from home or sheltering in place, but started to shift the lens pretty quickly to getting back to the workplace. And there's a lot of research going on in this space. This is some info from a PwC survey. It said that employers are trying to help on this, and employees are very much stressed out about the idea of returning to the workplace. So 70% of employees said something was going to prevent them going back, whether it was worried about the commute or childcare issues or other aspects, caring for family members, etc. So a lot of complexities to this return to workplace. A lot of fear, right? 51% of employees fear getting sick, and that's affecting their decision making, their experience, potentially their performance at work, etc. And 24% said they didn't want to take public transit, that there was a particular sensitivity to that, and public transit for many people is their route to get to work in an efficient manner. So a lot of barriers, a lot of challenges in this transition that need to be considered. And as employers are taking a look at the strategies in order to have a safe return to work, they're mainly looking at four main areas. Screening, which means asking people questions about symptoms, exposures, temperature, etc. That screening might be face-to-face or it might be virtual. Hygiene, obviously, hand washing, cleaning the workplace, etc. Distancing, so sometimes having a limited number of people back in the office so that there's more space, and having people not gather into meeting rooms, and then obviously masks as well. The one that I want to dive into in more detail in this presentation is about the screening part. So 43% of employers in the country surveyed in a Mercer survey said that they were implementing screenings and assessments. The CDC has some recommendations on their website recommending that screening should be considered as a part of a return to work strategy for employers, and they provide some specific guidelines about the kind of things that should be in a screening in order to improve the situation. And of employers out there that are implementing screenings, about 76% of them are implementing on-site temperature screening, and 53% of them are implementing some sort of symptom questionnaire.
Yeah, I think this is really interesting because a lot of the companies that we're talking to, they're in lots of different places right now. So there are some that have already returned to an office. There are some that are planning to return this fall. I think many that aren't planning to return this year at all. But across the board, the questions, the strategies that you have here, this 4-part strategy, these are the things that are coming up with a lot of our members. So it's interesting that so many companies are putting screenings in place. And I'm curious, because this is what we're hearing is, how do we detect, so how do we know when somebody has come down with COVID? Is the screening helping? Are these other hygiene practices helping? And what can we actually do to mitigate?
Yeah, I think screening is really probably the most challenging for everyone to wrap their heads around. And on the other hand, there are some people that feel really strongly about the screening strategy, but I think there's more we can illuminate about why it actually is more complex than people might think. I think the hygiene, the mask, and the distancing, they're all kind of no-brainers. You need to do those things. Maybe in certain environments it's a little tricky about how you do distancing in your environment, but the concepts are pretty straightforward. But screening, there's a lot of options, and there's a lot of challenging things to understand in terms of how likely is the screening to be accurate. So that's what I want to dive into here in generality, and then transition to some cutting-edge research about new kinds of screening. So that's kind of the journey that I'll take everyone on here. So the problem with screening is this, is before people have symptoms with COVID, most of the screening capabilities that are out there are quite poor in both what's called sensitivity and specificity. Sensitivity means of a person who has a condition, how likely are you going to pick that up? And what you're trying to do is minimize what are called false negatives, where someone actually has the condition and you miss it. Temperature screening is kind of at the center of this, because we have this preconceived notion that, hey, if somebody gets sick with COVID, they're going to have a high temperature. The reality is about 2/3 of patients, somewhere between 1/2 and 2/3, depending on different studies, who have COVID don't develop a temperature. So if you're screening for temperature, you're going to have a lot of false negatives, meaning somebody has COVID and the temperature doesn't reveal it. There are also going to be false positives there, because there are so many things that can give people an elevated core temperature, right? You could have lots of other infectious diseases, you could have inflammatory conditions, you can have a lot of different things that give people a fever. So it's not saying that temperature screening isn't a piece of the puzzle, but it's not infallible. And in fact, the majority of the time, it's going to miss things. Now, particularly, the fever might develop late in the course, so early in the course, someone is even more likely to not have a temperature. And why is that a problem? Well, what we know about COVID so far, there's still some contention about just how big of a problem this is, but what we believe we know is that people are most transmissible, meaning most likely to pass the infection on to others before they have symptoms, right? So before they have a temperature, before they have a cough, that's when they're most transmissible. So if we're just waiting for the temperature to kick in, it's a challenge. So a lot of different challenges here. And the one that I think kind of catches people off guard the most is that actual PCR testing for active infection has very similar problems to temperature and symptom screening. That means if you get a PCR test at day 0, meaning the day you get infected with the virus, the likelihood that it's going to be correct is almost 0%, right? Well, that's kind of shocking, right? Everybody thinks, oh, the PCR test is how you figure this out. Well, the PCR test is much better, somewhere around 80%, 70 to 80% sensitive, once you develop symptoms. So a couple of days after you develop symptoms is the time that your viral load is the highest and you're most likely to test positive. But before that, it's much more problematic. So if you're trying to do testing purely for screening and no one who has symptoms and you're just saying, hey, we're going to make you have a test before you return to work, the chances are that that test result is not very useful, because if you catch the person in that early period, it's going to be worse than a coin flip at getting it right. So not to say that testing isn't important. It's a very important part, but we need to know the limitations of each of these different methods.
Yeah, so I guess that brings up a question. Do you have a recommendation how often you do testing?
Well, I wouldn't say I have a recommendation. I would say that the data, and I'm not an expert on testing, but the data points to the fact that it's most effective not as a screening, just blind screening, but it's most effective for confirmation. If someone has symptoms, if someone has been exposed, then it's going to be quite effective. The sensitivity and specificity are quite good in those scenarios. But if you're just blindly screening as a guess to say, hey, we're going to screen everybody every week, in most populations, what's called the positive predictive value of that, meaning that takes into account not just sensitivity and specificity, but it takes into account how likely a person in the population is to get it. That's quite poor. So it definitely depends on your situation. There are certain situations where there's a really high risk and higher prevalence of the infection in that population, and that would drive the positive predictive value up, even though sensitivity might not be great. But in most cases, the numbers reflect that testing is most accurate in a scenario where you have an exposure or where you have symptoms. That prior to that, without other reason, it's very hard to figure out what you can do with that data. So from that, it leads us to say, well, what else could we do, right? Before I move on, though, I want to be clear. Testing is an important part of the picture. Temperature tracking is an important part of the picture, and symptom tracking is an important part of the picture. I'm not saying that these are bad practices. In fact, they're the right practices to do. But what you want to do is do them following the guidance of the CDC and other organizations, where you have an understanding of where these tests are likely to be appropriate and to have actionable data, right? So, and you need to know the limitations, right? But right now, today, there aren't a lot of other options to detect that pre-symptomatic period, so you need to use what you can. So those pieces are all an important part of the puzzle, but what I wanted to just highlight is what some of the edge cases are where you need to be wary about using them just as a blanket solution. So that transitions us to what is some interesting new research that might illuminate what's going on in that pre-symptomatic period and might help with this challenge. So folks may not know, so just a brief primer, that FitBit is involved in a lot of research. Some of it we're really deeply involved in, some of it we're just supporting researchers out there. We're approaching about 1,000 studies that use FitBits in clinical and healthcare research. We're the fourth most frequently used digital tool in clinical research. The interesting thing is, well, what's the number one? Well, the number one is a smartphone, right? So FitBit works with smartphones, and other technologies work with smartphones. So the other things that are on there are more generalizable tools, but FitBit's used really commonly in all kinds of research, from cancer research to diabetes research, weight loss research, etc., including research about disease detection and infectious disease. So prior to the COVID outbreak, we were doing research supporting Scripps Translational Research Center out in San Diego, and they were looking at the detection and surveillance of influenza-like illness. So influenza-like illness is a term that it's generalizable to febrile illnesses, febrile respiratory illnesses in particular, and influenza obviously being one of them, but there being a variety of them over the years, SARS, COVID, etc., all flu-like illnesses. And what their goal was to see, could they use data from wearables in order to detect population hotspots? And could they do so in a way that might give advanced warning signs compared to traditional disease monitoring, which used more manual processes that had time lag? And what they found is that they were able to not only detect hotspots, but they were able to detect them faster than the traditional infectious disease monitoring protocols in place in the United States. And they tested that in a bunch of different states, and it was consistent across them. And they look at things like activity and heart rate and other data from the wearables, including sleep, to see disturbances, changes in people's baseline at a population level. So pretty exciting work. It was before COVID came along, and then COVID came along, and pretty quickly, this is just a little more detail showing the shift in resting daily heart rate in the population with influenza-like illness. And then COVID came along, and Scripps was one of the first organizations to start a study looking specifically at COVID, not at influenza-like illness in general, but leveraging that experience, but also not looking just at population hotspots, but looking at individual data to see, is it possible to detect COVID in individuals using data from wearable devices? And another organization, Stanford University, about the same time, with similar set of experience, started a parallel study, and FitBit as well started a study to allow our users to share data to contribute to the science of early illness detection. And our three organizations formed a consortium where we're sharing ideas and trying to push the science forward so that we can potentially advance this ability to do early detection of COVID faster. And the exciting piece of this is that we're seeing encouraging data. Now this, some of these graphs are a bit small. I think you have some controls in your...
yeah, the top right-hand side of the screen, you can see those four arrows. If any of the viewers, if you'd like to make the screen bigger, just click on those four arrows. And also, feel free to ask questions, too. Leave your questions in the chat box as we go along.
So this is highlighting a bit more about the study that FitBit launched. So we gave our users the opportunity to consent into a study where they would say, hey, I'm okay with sharing my wearables data with Fitbit in order to help investigate whether the data in a secure and private way could help to fuel these early detection algorithms. And people also shared their PCR test results and the date of when they were tested and the test result, positive or negative. And they also shared their symptoms. When did their symptoms start? When did they end? What kind of symptoms did they have? And we had more than 100,000 people who have contributed to this, which we think is incredibly exciting, a very large set of data for machine learning algorithms. Over 900 people reported having a positive PCR test. Thousands of people reported having negative tests. So having both positive tests and negative tests is really important for developing algorithms, as well as having data before the person got sick and before they had the positive test. So you could see, what is their baseline like before, what is it like when they started reporting symptoms and when they had the test. And these charts to the right-hand side are just an example from one user, anonymous, right? So we don't know who that person is. But the vertical white dashed line in each of these charts is when the person develops symptoms. And if you look at breathing rate or resting heart rate or heart rate variability, Heart rate variability is a measure of the beat-to-beat changes in your heart that are healthy. Your autonomic nervous system, part of your nervous system, regulates your heartbeat in a way that adapts to all the different things going on in your body in a healthy way, so it's not a metronome, right? It's not beat, beat, beat. It adapts slightly, and that's a sign of a healthy heart and a healthy autonomic nervous system. All of those measures you can see here, breathing rate, resting heart rate, and heart rate variability, about 3 to 4 days in advance of symptoms, you see a pretty significant change from baseline. So this person's breathing rate slowly goes up on this about 5 days prior to symptoms. 4 and 3 days, it's up even further. A day before symptoms, it's up even higher. Resting heart rate, 4 days before symptoms, significant change from baseline. And the heart rate variability metrics as well significantly decrease. So with heart rate variability, a decrease means that you're more like a metronome, so not as adaptable. And that dropped off pretty significantly as well. So this just illustrates the promise for potential early illness detection by looking at a variety of physiologic metrics that you monitor every day, right? You can't go out and do PCR testing every day, partially because it's prohibitively expensive, operationally complex, and because we said at certain periods of time prior to symptom onset, sensitivity and specificity are really low. If you could put a wearable on someone, monitor every day, operationally much easier, cost-wise much lower, and it's quite sensitive, right? So your body reacts, the way you breathe, your heart rate, and the fact that we're looking at multiple different organ systems here, so we're looking at your respiratory system, your circulatory system, and your autonomic nervous system, we're respecting the fact that COVID is heterogeneous and is a very tricky player, right? It doesn't present the same way in everyone. If there's one thing that we've learned, it is very heterogeneous. So by looking at a wide range across physiologic systems, you have this enhanced capability to catch outliers. And in addition, you have the chance to improve your specificity, meaning you want to limit the number of false positives where you accidentally say the person has COVID, but they have something else. Now, arguably, it depends, right? If someone had the flu and you said it was COVID, in today's environment, maybe not so bad, right? Because probably don't want someone coming back to the office who has flu. But if they had something else that wasn't infectious, you want to be really careful not to say they're positive, because then they're not getting back to work, you're causing other problems, right? So sensitivity and specificity, both really important. But this is quite exciting.
That actually was what I was going to ask is, do you know of other illnesses, or are there other conditions, I guess, that would cause a similar pattern? Or, what is the likelihood that it is actually COVID?
Yeah, we are right up against getting to the point where we can produce sensitivity and specificity measures for this. What I can say in general is that the numbers look quite encouraging, not infallible, but look quite encouraging that the specificity is reasonable. I think that, as I mentioned, sensitivity is probably really important for most situations. You don't want to miss cases, have them come to the office. So you want to turn up the sensitivity. And the nature of these algorithms is you actually effectively have a knob on this, right? There's a set point with a certain sensitivity and specificity, but the way these machine learning algorithms work, you can say, hey, it's okay if we accidentally say that some people with flu have COVID for this use case, because we'd rather be safe. And you turn up the sensitivity and say, let's catch as many cases as possible, but we're okay if the person had the flu or had a sinusitis or had some other kind of infection that was throwing this off, because we're okay with that coming to work while they're sick. On the other side, there might be certain application areas where you want to be really careful about specificity, and then you can tune the algorithm the other way, and you can make it so it's less sensitive. So it's going to miss some cases, but it's going to be a lot more accurate about not getting any false positives. So hopefully soon we'll be able to report out some more data actually where our numbers sit, but I think this particular example speaks very well about just how powerful this approach is, and it's quite encouraging.
And on an individual, a personal note, so I've seen on the Fitbit app the banner at the top that says, "Will you help us in our research?" So you have to opt in to this, correct?
Yes, you have to opt in.
Click on that in the app and opt in, okay.
Yeah, for a couple of reasons. One, because we needed to collect some extra information from folks about their test results, and the other is it's quite a sensitive thing, right? It's not something that people expect is part of the Fitbit experience already when they sign up, and therefore we want to be very clear with folks that, hey, you want to be a part of this greater public health initiative, here's an opportunity, but if you're not interested, no problem. So we wanted to be very clear with folks on that, and like I said, we needed to collect that extra information about symptoms and about test results, because that's what helps us to know how far in advance of symptoms we are, and whether or not the person actually tested positive, so we have a standard to test against. Now the trick is the border of how sensitive and how specific you can get in these algorithms is somewhat limited by the sensitivity and specificity of the PCR testing, right? Because you have to train with something that is your definitive result, but as we know, sometimes that test is going to be wrong. So there's a couple of extra tricky things there, but those can be overcome by looking at some populations where there's extra testing. So a lot embedded in there. Hopefully we get some questions that we follow up with on that. So
yeah, and well, I guess for our viewers who are interested in learning more about this study, will something be published, or is there a website they can go for more information as you move along?
Yeah, our plan is to put more information out there publicly as soon as we have that packaged up nicely. We can work with the conference board to make sure that we share that so that it could be downloaded in follow-up with this webinar, so we can coordinate on that front and find a way for people to track along as this is going, because the nature of this kind of work is that it's going to be evolving every week, right? It's not going to be something static that's done. Even once you get to the next stage, you constantly want to be collecting more data and making things better and better over time. So from there we transition to, well, how do we put this all together? We talked about helping people adapt their behaviors while they're sheltering in place or while they're working from home. We talked about the piece of helping people to detect COVID early because of the limitations of existing screening methodologies. And the other piece is, to your question, Amanda, folks are stressed. They're overwhelmed, and their mental well-being is challenged as well. So what we at Fitbit wanted to do was combine all these capabilities together into a solution that provide employees the additional mental and emotional support that they need, and all of those other pieces. And here's a high-level overview of what it looks like. It's a modular offering, because every employer that's out there is in a different part of their journey. So some of them are saying, hey, we've got to get people back to work now. Another employer is saying, hey, we're not going to consider this until Jan 1st. And another employer might be saying, hey, we need to bring some people back now, but others may work from home indefinitely. So everybody is on a different part of this journey, needs different pieces, has a different population with different needs. So one of our first tenets was, let's make this modular so that we can meet their needs at different times. And obviously some of the pieces are things that folks may already know about Fitbit. We have programs with about 1,700 employers and health plans across the country where we deploy devices and tools to help people be more active and eat better, sleep better, and manage stress. And we have a solution called Fitbit Premium that provides a lot more self-help tools on top of that. So it's not just your device and the data, but it's those mindfulness videos, workout exercises, things called guided programs that walk people day by day through getting support in particular areas of behavior change. Say that someone wants to increase their step count, or they want to try to eliminate added sugar in their diet, or they want to try to manage calories in and calories out more effectively. Each of these programs takes the person on a day-by-day journey. And we also have human health coaches. So a person who is there for you in the Fitbit app, instead of chatting with you once a month or once every couple of weeks, they're there to be there for you every day. They can see your data flow, they can help you create goals, and they're a human that is there to really walk you through that experience. And then we have the pieces, podcasts and webcasts, a curriculum that employees can follow around emotional well-being. And then we have this daily check-in experience that combines all the things that the CDC recommends. So it does the daily symptom tracking, it does the tracking of daily temperature, and it does the tracking of have you had any exposures, and follows all the CDC guidelines. So this is kind of baseline state that most employers thinking about some kind of employee attestation need to have in place so that people don't have to come all the way to the workplace to get screened only to find out that they have to go all the way home and that they took public transit and put themselves at risk. So that's becoming pretty common in the marketplace, but in addition has this ability to track the health metrics like heart rate variability, and breathing rate to potentially give people advanced warning signs prior to developing symptoms or prior to developing a temperature. So all of these pieces available so that if your population really needs help in dealing with the stress part of it, we have the podcast and health coaching. If they're ready to get back to work, they can also have the daily check-in and mix and mash those together as it's appropriate.
That's great. So in terms of the research, can you talk a little bit about what's coming up next? So you mentioned a few things that are, you're kind of at the point right now. So can you give us a little teaser of where's the next place that you're going with this?
Yeah, I think the things that I can say are that there's a lot of data to crunch through there. So over 100,000 users and thousands of people that have reported tests. So a big part of it was to crunch through that data, figure out which data points really matter. Because as you can imagine, we have data about people's activity, their sleep, their heart rate, all these different things. It's a vast ocean of data to figure out what works and what doesn't. So what you saw today is we've narrowed that down to some of those data points that appear to find the best balance of not missing people, but also not getting the screening wrong and telling people that they have it when they don't. And so that was the first part of it. And now what we're doing is crunching through different algorithms and in order to evaluate what's the best sensitivity and specificity that we can achieve, and at how many days in advance of symptom onset can we optimize that. Because I think this data is probably going to prove valuable both before symptom onset and after, because even if someone does develop symptoms, a lot of people are in denial, or their symptoms are non-specific, because lots of symptoms of COVID are non-specific. So we think that giving people the additional data even after they have symptoms is going to help the cause, because it's going to make people more alert, more mindful, more likely to take action. Also helps inform the employer so that they can help support people with appropriate privacy and sensitivity, right? This is a tricky space because we want to help all the employees, but we don't want to sacrifice their privacy with the employer. So that's kind of a separate discussion, but something that we've taken care in the way we built this solution to protect that. So we want to enhance that period after symptoms, but we also want to fill that gap that's completely void right now, where before symptoms, there's almost no reliable way to cost effectively try to get signs early there. And our next step is really to pin down those numbers of just how reliable it is in that period of time, so we can help inform people about how to use it to its maximum capability. So that's really where the research is going, and we're part of this consortium with Scripps and Stanford. We're all sharing ideas about what's working and what isn't, and advancing the science. But there's a clock running, right? That if we want to have an impact on public health, we've got to move as quickly as possible. So we're certainly aiming for a short time period to have next steps on this, and we hope to share with all of you as those come out, and we have some hard numbers about what we're able to achieve with this.
Yeah, and I do want to go back to the privacy piece, and I know that this is a tricky subject, but it comes up a lot. And you mentioned that in the research aspect, you have to opt in.
Yep.
To be part of what FitBits doing. So in terms of for an employer who is offering this to employees, can you talk a little bit more about how that privacy piece works and how to ensure that employees feel that their privacy is being taken care of?
Yeah. So there's a couple of aspects of it. One is very clear, transparent conversation with the participant to make it clear for them what they're opting into, give them the opportunity to opt out if they don't agree to it, but to let them know this is the purpose of this. It's being shared with a minimum set of people at your employer possible in order to inform their decisions across the populace. But for you as an individual, we're sharing the minimum amount of data possible. So part of it is that clear communication. What are they opting into? What's being shared? What isn't? And then the other part is just that. It's what do we share and what do we not. So what we do share with the employer is for each individual whether they effectively have any signs pointing to a need to not come to the office based on the CDC recommendations of having symptoms, exposure, a positive test result, an elevated temperature. Right? So those are pretty well established. And instead of communicating what are the person's symptoms or what is their temperature, we report to them a high-level code that says, hey, one of these factors was off, but not more granular personal data beyond that. So it kind of strikes a balance. So the employer knows, hey, somebody in my population who works in this area of the building, so we share that level of information too. We can help to lay out where do people sit, where are they in the building, who might they be around. A person in this area in the building had an exposure. And then the employer then has the data to know, well, how do we control this? Do we have this area of the building not report to work because they may have been exposed to that person? But we're not sharing what was the person's temperature and symptoms and all the granular information. And we're only sharing it, and we're making sure that the employers that we work with basically sign a pledge to only use this for the purposes of keeping their employees safe and doing it in a way that only involves the minimum set of people on their team that need to have exposure to this data. And there's a pledge that they need to go through with us. Obviously, we can't enforce that, but we want to be very clear to all the parties involved what we think are the best practices there in order to protect that privacy.
Thank you. We did get a question, is there a minimum model of Fitbit to get these numbers? So I think that's,
yeah.
Does this work with any Fitbit device?
Yeah, so the current research that we're doing can be supported with any device that has that has the ability to measure heart rate. And so in our current line of devices, that is all but one device. So we have an Inspire device that is just the Inspire, and it doesn't have heart rate. And then we have the Inspire HR that does, and then all the other devices in the lineup have that heart rate. The daily check-in and the rest of the experience will all work without having a heart rate enabled device, but the enhanced capability where we're doing this research, that part requires heart rate, because you use the heart rate to figure out the respiratory rate, the heart rate variability, and the resting heart rate. They're all derived from the granular heart rate data.
And I just want to clarify too, this is available now, right?
Yeah, so our
research is still ongoing, but this is all available now.
Correct. The Ready for Work offering is available now. It has the whole daily check-in process. It shows people their health metrics in order to help them pick up any signs early. What it doesn't have today is the ability to say, you have this % likelihood of having COVID, right? That's the research work, but that doesn't take away from the current value in all the other pieces, but that's something that we hope to enhance over time based on the research work. But the metrics and the ability to visualize them, like I showed you in that one picture where you could see if your metrics were going off, that ability is part of it.
Terrific. And I think do we have a slide for where to learn more?
Yeah, so this is just one more slide showing some screenshots of the different experiences that people have through the daily check-in experience and symptom tracking. And then here's some contact information for those who want to get connected and learn more, either about the research in general or about some of the solutions that I shared at the end.
Yeah, thank you. And I think it's particularly right now, I just know in the research that we do, it's every day. Something new is coming out. We're learning something different. We're thinking about reopening, and then we're slowing down or speeding up. So it's really is kind of every day thinking something new. So it will be interesting to kind of track how this research goes. I know you said it's being updated every week, so interesting to see where it leads to.
Yeah, it is. It's a pivotal time right now in this public health epidemic, right? We certainly having this data even earlier would be better, but now is still as pivotal a time as any, especially because now is the time that folks are thinking about getting people back to work, which potentially creates this new resurgence of risk, right? Or people are going back to school, or people are going back to normal life. This is where we think we can have the most impact in this journey, because the first step was isolate, physically isolate and minimize contact. Now, as we consider getting back, the best thing we can do is do so responsibly in a way that's informed by the best data possible, so that we can minimize any risk to anyone. So it's still a pivotal time, and we're working as fast as we possibly can to take what we have every week, every month to the next level.
A couple people typing, so we'll give it a couple minutes, but really appreciate this. And
any other questions?
there are all kinds of things happening right now, but I have not heard of anything like this going on, so it's good to hear. Okay. Absolutely. All right, we're getting some thank yous. So
Well, we thank you for having us, and we're really glad to share and do our part.
So I will close this out then. Thanks again, John, and thank you to all of you who are listening online.
Great. Looks like we just
and submitted your questions.
Yeah.
And it looks like we have a few more slides here. But I do want to share a couple upcoming events from the conference board. So we are very proud to have FitBit as a sponsor for our Employee Engagement and Experience virtual series, which is free to members of the conference board. So we have 2 upcoming sessions on September 17th and October 1st. You can visit conferenceboard.org/engagement summit to learn more. And again, Fitbit will be there, and maybe there'll be some updates at the summit. If you enjoyed today's program, then please check out all of our upcoming webcasts. You can do so at the link here. You can download this presentation to receive the links in the deck. Visit conferenceboard.org to see a full list of our virtual events coming up. And in addition, we do have a podcast series. So the Human Capital Insights podcast is a great resource for talent executives who are looking to stay informed about current issues across the human capital spectrum. So you can view those at conferenceboard.org/podcasts. And finally, if you are interested in sponsoring a webcast like the one that you saw today, you can reach out to us at sponsorship@conferenceboard.org and talk more about those opportunities. Just a brief reminder, you will see an evaluation come up on your screen in just a moment, so please do take a minute to complete the evaluation and provide your feedback. And thanks again, thank you John, and thanks to all online for your participation today. I'm Amanda Popila, and this has been a Conference Board webcast. We will see you next time.